Hey everyone, my name is Zak Holdsworth and I'm the co-founder and CEO of Hint Health, and I'm very excited today to be joined by Nathan Udy, who's the founder of Zion and also the president and CEO of Plantston. And I'm going to kind of hand off to Nathan in a second to do a quick intro, but just for those of you who don't know, as I mentioned, I'm the founder CEO of Hint Health, and we're a company that's been dedicated for the last decade to supporting the growth and success of the direct primary care movement. And we really believe that direct primary care should be kind of a foundational element of the United States healthcare system. And so we're very excited today to be talking with Nathan about a very exciting partnership between Hint Connect and Zion and Plantston as well. And so one thing I'll just say is we've had a great partnership with Zion over the years. We've been working with them for many years, and they've become a sort of somewhat of a staple in the DPC industry. Many DPC clinics work with them, have their patients enroll with Zion. It's a really powerful solution for managing costs and providing great access to these to the patients of DPC clinics. And so the thing we're going to be talking about today is a sort of way to better make it easier for patients to get access to both a really high quality health share, as well as DPC, all in a single simple experience for that patient that both reduces the costs and gives access to these amazing products. And so I'd like to just kind of, before we kind of dive into the partnership though, what I wanted to do is just have Nathan kind of give a quick intro to himself, give a bit of an overview of Zion, and also just maybe share some of kind of why he's excited to be sort of doing more work with DPCs. So maybe Nathan, just if you just want to spend a few minutes there.
Sure. Thank you again. Also very excited. Working with Hint has been a pleasure, and we love working with DPCs and value the partnership that we've had over the years with many different DPCs. So Zion HealthShare has been a wonderful thing for a lot of people, and we've had a good time as I've founded Zion HealthShare. I've aimed to make it so that it was a solution that was there for the members when they needed it most, and making it so that we can be a disruptor in the market, that we could be able to help change it for the better together. And when we started, one of the first things I identified wanted to work with is DPCs, and knew that would be a great way to partner with like-minded companies and individuals and people. And so it's been a passion project for me, and really have enjoyed this opportunity, and it's been an honor. So that's a quick little background on from a high level of what Zion HealthShare has been. Plantston is something that I founded before Zion HealthShare. It's a third-party administrator, and we work with companies and we provide different administration services for benefits. One of the things that we have is the MemberGateway, which is a membership-based program that we use to manage and work with Zion HealthShare and other memberships.
Just before we jump into kind of talking about the specifics of this partnership, Nathan, can you just share maybe some case studies or just examples of how you've seen sort of the power of DPC and Zion? You know, maybe some anecdotes or just examples that sort of jump out for you in terms of how the two work together historically.
Oh yeah. There's a lot of different DPCs, and there has been a combined effectiveness for the members. So when we work with DPCs who help quarterback the health of a member, they're able to help identify problem areas more quickly. They're able to provide a great hands-on approach to someone's healthcare that helps reduce the overall costs of a medical cost sharing organization. And so we've seen definitely a reduced strain on the membership community by working with DPCs, and we've really enjoyed that partnership because they help facilitate and they're an extra advocate for those members in helping them be healthy and pointing them in the right direction for lower cost services and just really effective ways of using their healthcare dollars.
That's great. And so what we're going to be kind of showing you and kind of walking through with you today is how Zion is partnering with Hint Connect to create essentially a bundled offering for the consumer, for the patient. And so what we're doing here is essentially, for those of you who aren't familiar with Hint Connect is a network of DPC clinics that we'll have a contract with the DPC clinic or the network. We partner with many of the DPC networks as well, which will enable a kind of a single purchase point for the end consumer in a way that's bundled with Zion. So the idea is that over at Hint, we're kind of making it easy for innovative health plans or health sharing organizations to partner with DPC at scale. So the idea is that through this partnership with Zion, they can have a single contract with Hint Connect, but then get access to 500 plus DPCs who are all kind of partnered up with Hint Connect to enable a very smooth and seamless experience for the end consumer. And so this is really exciting because when you combine these products, what we're actually doing is bringing a lower cost product to market. And so maybe Nathan, if you could just jump in and spend a little bit of time talking about kind of how this works and also how the kind of pricing works relative to if a consumer was to purchase Zion and DPC separately. Kind of give a little bit of an overview of kind of what the pricing dynamic there is and the competitiveness of that product from a pricing perspective.
Oh yeah, absolutely. This new approach for being able to partner with Hint Connect and having a DPC membership paired with a Zion HealthShare membership is very unique to this situation. So in the past, we had what we call a 4-tier pricing, where you have your member with spouse, member and children, family, and that's kind of a flat rate for the 4 tiers. And that hasn't always been the best matchup with DPCs from a pricing standpoint. As you know, the DPC pricing is typically going to be a per member rate, and it's going to be sometimes age rated or not, depending on the practice. What this will do, we'll be able to help mirror or interchange a lot better with those memberships with the Hint Connect with Zion HealthShare, so that we're both using a membership based model, and so prices are more mirrored and more streamlined that way. So it's a lot easier for DPCs, for members, to be able to see them work together instead of having 2 different pricing models.
Yeah, and yeah. Oh, wait, keep going. Sorry.
Yeah, no. The thing I was going to say as well is there's a great advantage for the pricing standpoint. It's a competitive rate for this lower than you typically find just going on Zion HealthShare's website and getting a membership there. It has what we call the Zion HealthShare Essentials membership with the preventive add-on, if you will. So that allows for members to get things like colonoscopies and mammograms and so forth, preventative, to be able to be shared with the community as well from that standpoint too.
Yeah, and maybe one thing to just drill in on, I think, is an important point here. If a member were to sign up for a DPC clinic and then separately sign up for Zion, the total cost of that product would be, of those 2 products, so purchased separately, would actually be more expensive than the bundled product that we bring to market here. And maybe just spend a minute. Why, how, and why are we able to do that? Like, what is unique about DPC that allows you, in your mind, to kind of for us to actually bring what is already actually quite an affordable product and make it even more affordable when it's bundled like this?
Yeah, I think that's a great question. I talked a little bit about the effectiveness of DPCs that we worked with in the past, and I think it's a testament of the past relationship that we've had with Hint and with the DPCs in the past, because we've seen great success with reducing the strain of the for the membership community by having that together. We find that we're more effective together. We have a video on our website that talks about DPC plus Zion HealthShare is like peanut butter and jelly, and I love peanut butter jelly. I grew up on that. That's one of my favorites, and that's part of why, how I see DPC and Zion HealthShare together is because we're stronger together. We're better together because we of course will depend on the DPC community to help with the members and helping to reduce the overall cost of a community, and of course being there as an advocate, as a help to those members and driving the change that we need to see in the marketplace. That's
great. So I'm actually going to pull up a few screenshots in a minute, but just wanted to know if anyone has any questions, please, we want to make this interactive. Please just drop them in the chat box and someone from our team will surface them to us and we should be able to answer things on the fly. So, please kind of ping us with questions. So we're actually going to screen share now. Let's just pull up these slides. So this here is, if you go to hint.com/ecosystem/Zion, or if you just go to our partners page, you can do a search. But this is really the sort of landing page for providers that are interested in learning more about the Zion plus Hint Connect kind of DPC centric offering. And you can see here, any provider that is in Hint Connect already has already joined with Hint Connect will actually already be, this plan will be made available to them, right? So this is something that if you've already joined Hint Connect, the price points for, we've set a max price point for this plan to ensure that the Zion team and the Planston team can kind of price it effectively on their side. So it's an $85 is the sort of the max rate for, at least right now for this plan. But if anyone is not part of Hint Connect and you're interested in joining Hint Connect, you can kind of do that here, and someone from our team will reach out to you. But I just wanted to kind of share some of the benefits and view the sort of the actual consumer-facing element of this, where people can actually can enroll from. So we're going to click over here, and you can see the enrollment. Okay, so right here is this is the landing page for the Primary Care Plus HealthShare, the DPC Zion plan, and you can we're going to sort of walk through some of the benefits here, but jumping down, maybe Nathan, do you just want to spend a minute kind of just talking about what you're getting in both across the board in terms of this bundled product offering?
Right. Yeah. So there's, as you'll see there's two different pieces. The direct primary care, that's our direct primary care Hint Connect members or practices, and so with that they're getting those services that are provided by the DPC and helping keeping them in a healthy way and making sure that they're being that good quarterback for those DPCs. Not to spend too much on that side, because I'm sure all our DPCs are very familiar with their own services, but we, on the Zion HealthShare side, that piece is the essential membership with the preventive sharing services that are included with it as well. And so again, members are able to share with each other as a community, and those medical bills are presented and that works for both the preventive services and bigger services such as heart attacks or surgeries and births. We've helped a lot of babies come into the world, and and we have a really good team for that. Lots of world-class service there that we help with our members there.
Awesome. Before we jump on to the pricing side, there's actually a couple of questions that came through, and I just want to answer them.
Sure.
So the first question was from Paul Reynolds, and the question is around how they're, typically they only kind of understand that their health shares are 50 and fewer people. And so maybe you can kind of answer that. But what I will just start out by saying is this product, at least for now, is a product that's designed for on the retail side, so the consumer side. So this is actually right now only available to individual members. But I think the vision medium to long term is that we can expand this and actually enable access to employers. But Nathan, do you want to just quickly answer the question around the sort of employer size, and sort of eventually when we do get to that point, what would the options be there?
Yeah, that's a great question. Health sharing is it available for companies over 50 people? And the answer is that it is available. We have many companies that we work with today that use and utilize Zion HealthShare. That's over 50 employees, so that's not a problem. There's some compliance pieces there, and we can help with that. So to Zak's question, or to Zak's point, in the future, what we're going to be able to do is allow for some of those compliance pieces to be able to offer through Planston, and that's what we specialize in with Planston, and we pair that with Zion HealthShare, and Hint Connect is that future.
That's right.
That's what we're really excited about, because that will allow us to be able to get into those bigger employers, provide the compliance pieces that they need, and also help change healthcare for the right things.
That's great. Yeah, so we've actually got another question here from In Touch Primary Care. So we'll get through these questions before we jump in. So doesn't it have Hint? I can maybe address this one, Nathan. Do you have to have Hint to participate? And so the short answer is no. The way we work is through the Hint Connect side. Is if you're not a Hint, if you're a Hint user, then we just connect it up to your Hint account, and if a member enrolls, they'll flow straight into your Hint account, just like any other member. So it's quite smooth and seamless. If you don't have a Hint account, you can definitely join Hint Connect and become part of this. What we'll actually do is spin you up a free sort of stripped down Hint account. So you're able to get the members that are enrolling. You can log in, get your members. If you want to, you can download them, and you also get paid through that. And that's just how, our way of sort of getting you those members. But you don't have to be a sort of paying Hint customer using our product. We will just create a portal for you so that you can get in and kind of get access to those members. And so then there's actually one more question. Then we're going to jump into pricing and go back to the demo just so we can sort of make some progress. So the next question is from Mike McCarthy. So our DPC has some excellent rates for lab and radiology. Could the patient use our rates and submit them to Zion for cost share? So Nathan, do you want to maybe, I think I know the answer to that question, but why don't you take that one?
Yeah, sure. Yeah, those services that are outside of your typical membership fees that you have for your DPC, such as the labs and other services that there might be. I know some of our DPCs will do surgeries and other things. So we want you to continue to be a good advocate for those members. And so the short answer is yes, you could, if they're a shareable expense, you'd be able to submit, the member will be able to submit that expense for sharing with the community.
That's great. And Nathan, at some point, maybe we could explore ways of automating that even further. So I've got some ideas there, but we maybe shouldn't flush them out online, because I might get in trouble with my product team.
Sure.
And maybe your product team as well.
Sounds great.
But anyway, so maybe just jumping back to this demo here, and feel free, please hit us with more questions, and we'll get to them in a second. The other thing I really wanted to kind of just address here is this, for me, is just like the kind of the most incredible part of all of this, which is the price points, right? And maybe Nathan, why don't you just kind of walk through how this works and kind of just talk it through.
Yeah. Earlier we talked about two different pricing models that were kind of conflicting with each other, the DPC members per member rate, and then the 4-tier pricing model that's typically there for Zion HealthShare. And so this model really marries them together. You'll see that the rates are based off of a per member rate, and it's age rated. So you'll 0 to 17, 18 to 29, 20 to 49, and 50 to 64. Our memberships will end at once they turn 65. And so those rates are separated by their IUA. And IUA is an initial insurable amount. That's the amount that the member would pay for their own medical expenses. And then after that, it would be shared with the community 100% for that based off of the member guidelines. And so it's either 1,000, 2,500, or 5,000 is that IUA amounts. And really affordable, very different than insurance model, which is why it works so well.
Yeah, I think that the thing I just wanted to make very crystal clear here is that this pricing includes the DPC fee. So, and so I think that's just sort of, I want to just make that very clear. If you come in and you're 18 to 29 and you purchase let's say you're actually 30 to 49 and you purchase the 5,000 IUA product, it's going to be $218. And that will include both the Zion component as well as the DPC component. And so it is quite amazing. And I think something just to not sort of fly over too quickly. So from there, now if the new patient wants to enroll, this is where I'm going to kind of demo how this works. So someone comes through, I want to sign up for this. They can now click the enroll button here. And what you're going to notice is this is a kind of a sign up form. And I'm going to put in a kind of a fake patient in here. So we're going to kind of get through this enrollment, get their address. We will kind of get their date of birth. And if needed, I can add another member to this. But for now, I'm just going to continue through to the memberships page. I'm going to choose that 5,000 IUA product, which you can see there. We can kind of, if they use tobacco, there's an additional fee, but if they don't, there's no fee. So we kind of capture that. And from here, this is where it gets really exciting, right? So if you, now is where you would select your DPC clinic. And so this is the list of all of the DPC providers that are listed as part of Hint Connect. And you could come in and do a zip code search if you wanted, and I'm just going to do a zip code search here. I'm going to say I'm interested in something within 20 miles, and there's just one provider in this instance. And I can learn more about this, get the bio, a little bit about this doctor, and I can select this doctor. And from there, and actually before I continue on, I just want to make one thing clear. We'll get through this, and then I'll share this other point I was going to make. And from there, you can kind of continue to the confirmation page, put your payment information in, and agree to the various terms and conditions. And once you click this confirm button, then we will not only enroll the patient for Zion, but instantly enroll that patient into this doctor's Hint account or their free account if they're not a Hint customer. And that doctor will get paid at the end of the month with all their other, in a single check that comes in monthly for all of the members that they have coming through that Hint Connect pathway. So very simple, elegant design to really simplify the process. Now, one of the things that we are going to be enabling here is we know that many DPC clinics want to make a referral to a plan like this, right? If they've got a patient who's interested in, maybe they're sick of their insurance and they're looking for an alternative, and they want to sign up for Zion, what we can actually do is give that provider a unique link that is unique to their clinic, and you can either request that from the Hint team or the Zion team, and we'll get you your own unique link. And what that will do is when a patient clicks on that link, it will actually only select your clinic, right? So we'll actually skip over the clinic selection, and they will just be automatically enrolled in your clinic, so that you're not sort of having to worry about, if you send a patient this link, will they potentially maybe choose another doctor or something like that. So there's a way of essentially giving, really, you could have on your website your DPC sign up, but you can also have your Zion plus DPC link, and both of them will enroll the patient in your clinic. One will enroll them in just DPC, the other one enroll them in HealthShare and DPC in this bundled approach. So really exciting. It's a very smooth experience here. Nathan, anything to add to this before we jump on and kind of answer some of these other questions that are coming through?
There's so much I want to say about this, but I'm going to try to keep it brief. And that is that over the years working with DPCs have said, hey, how can you send us members? And the answer is this right here. We could send you members through this type of approach. You're getting set up with Hint Connect, make it so that you can be one of the providers. We want to be able to funnel members through this system and make it so that you can get members. So we want to help you grow and want to help support you. We all win together. And so that's one thing I wanted to mention just from a real quick thing. There's I know some questions. I don't know if we want to dive into questions yet, but
yeah, let's do that. Maybe just get that screen share down. So there's a question here from Kirby. What if the DPC component is a different charge? i.e., how much is the DPC charge for the providers? Okay, so the way Hint Connect works is you're able to list your prices, right? So, and we typically ask that you're giving us your a competitive rate, that let's say your most competitive rate, but you get to choose your price when you join Hint Connect. Now with this program, any providers that have a price point that's above 85 won't be in this program, right? We've set a limit just because it allows us to make sure that the cost of the program is kept low. And then what actually happens is, if the way it actually works mechanically on the back end is, let's say someone signs up and they pick a provider that's actually, let's say $80, then they'll actually be, some of those funds will actually essentially go back into the sharing community. So basically, as a provider, you're getting paid what your rate is, and we're able to kind of standardize the costs across the board. But those additional funds, if there's a difference, will actually go back to the sharing community. So short version, you set your prices. Contracts are really kind of like provider friendly. We've really designed the Hint Connect network to be very DPC friendly, because we think it's really important that the providers are in control and get to practice the way you want to practice. Now we will. So that's kind of the answer to that. Kirby's actually had another great question. How do we get connected and vetted to be one of these providers? So just jumping back to the Hint, if we could just do a screen share here, team, hint.com/ecosystem/Zion, or you could go to connect.hint.com. But if you click on this on this Join Hint Connect button, then that's going to take you through. You can put all your information in, and someone from our team will reach out to you. Now there is a contract you'll have to sign. There's a certain minimum set of requirements in terms of what you're committing to when you sign the Hint Connect contract. But those commitments are all things that, if you're doing DPC, you should be more than happy to agree to, right? They're very standard DPC provisions, essentially. And really what we're doing there is just ensuring that the quality, that we're maintaining a high quality product, and that the providers actually are delivering the value of DPC, is, let's say, opposed to let's say just a fee-for-service clinic that just says, hey, I'm going to take a membership fee. We will likely require a few things that maybe they haven't set up or aren't actually delivering at this point, so that they wouldn't make it through the vetting process. So short version, contact our team. They'll be more than happy to walk you through. And as you can see there, there's a link you can go to. And there's another question, actually. Would you add anything to that, Nathan?
No, I think that's perfect. And I could take the next couple questions.
Yep. for sure.
Okay, so the next couple of questions was about credit card fees and ACH. Yes, both credit card and ACH is available for members to be able to use, and those fees are paid for through the program that's the MemberGateway manages. So there's no fees that you would have as a Hint Connect physician that you'd have to pay for. So you're getting your contracted rates.
Yeah, and Paul, your next question: could we set up an ACH? Per Nathan's point, when you get your Hint account, if you're already a Hint user, then we'll just automatically be able to ACH directly to you. If you don't, that's the way that the payments work, and so you're able to. It's our standard, ACH process there. So if there's any questions about that, our team can take that on and answer that as well when you're onboarding into Hint Connect. So there's another question from InTouch Primary Care. Do you pay a fixed fee to DPC? Is it a yearly or monthly membership? So yeah, Nathan, do you want to maybe address that one?
Sure. Yeah, it's a monthly membership fee that you have for your Hint Connect contract. So that would be sent to use through the Hint system, just as Zach was talking about.
Yeah, and it's automated, right? So once that member comes through, they'll enroll into your Hint account. And again, if you're on one of our free accounts, you'll get a notification. If you're using Hint, it will just sync up to your EMR and be in there automatically. And then you get paid out at the end of the month automatically as well. And you can kind of see how much you're owed and has it been paid yet and things like that.
Yeah. The next question I could take too, it's about selling brokers that you might have. If there's a broker or a marketer that you might have, we could get them contracted through the MemberGateway team, and we could compensate them as well. So that's something that we could help with.
So this is a good question from Eric. Nathan, is there availability of any co-branded materials that we could provide to prospective patients or small employers? And what is the website we send patients to in order to explore their options and prices? So maybe, do you want to take that one, Nathan?
Yeah, so the earlier Zach kind of demoed the website that we have for it. It kind of outlines the program for both DPC and also the Zion HealthShare. And so we provide that to, of course, any of the employers that want to participate. They can look at the website. They can learn more about the program and of course go ahead and move forward with enrollment. So as far as materials, we at this point in the early stage of this process is we have the online or the website for materials, but we're glad to continue to develop additional materials as needed as well.
That's great. And we've got another question here these are great questions from Mike McCarthy. Is Zion membership time delimited? i.e., does the member have to sign up for a year? We do most of our work up front developing a plan of care, so we typically require 12-month commitment. Yeah, Nathan, do you want to address that question?
Yeah, that's a great question. Zion HealthShare doesn't require a specific time frame, so members could come on and off from a Zion HealthShare perspective. We of course love the idea of having a commitment, especially when you're committing to your health and making sure that you develop a plan that would work to improve that. But the Zion HealthShare, from a Zion HealthShare perspective, we don't have a contract requirement for a length of time.
Yeah, and maybe Mike, I'll just add something to that. And by the way, I love that you do all that upfront work and that you really provide it, wrapping your patients in great care. So that's awesome. And I think one comment I'll make is that, like Zion, the Hint Connect contracts are sort of, there is the ability for members to come on and off. But unlike a retail, let's say a typical retail, at least what we see is unlike a typical sort of retail offering where patients may decide, hey, I'm going to sign up and then term as a general rule of thumb, when members are coming through Hint Connect, they're either coming through, let's say, an employer, through, let's say, a network or an employer, or through some type of plan like Zion, where I think the intention is, I'm an employee, I'm signing up, right? I'm not, unless I'm terminated, which could happen, and then you would lose that member 3 months in. But that's more of an edge case as opposed to, let's say, a patient that's wanting to abuse the system. And again, same with Zion, if someone's signing up for Zion, more likely than not, they're looking for something long term as opposed to just a month of HealthShare. Like that wouldn't really make sense because they're not going to hit their RUA. It's sort of, the incentive is not really there to kind of abuse the system like that. So although technically they could roll on and off, the law of averages kind of has it such that you're not really going to be at out of pocket, if you will, for the most part. Yeah, there's some limitations to how we address that issue. Greetings. I'm missing the details of coverage on your MemberGateway website. From Troy Burns. Maybe Nathan, do you want to address that?
Yeah. Well, let me first say that it doesn't go into detail of everything for Zion HealthShare on the website. It kind of gives you a high level on the MemberGateway website. I would refer, if you want to learn more about Zion HealthShare, to Zion HealthShare's website. There's a lot of good materials there. So just zionhealthshare.org, and there you'll be able to learn more about the programs and of course the different sharing guidelines that we have, and there's a lot of detail there. The Zion Health or the MemberGateway website kind of talks about it at a high level. So I'd say that would be two different resources that you might dive into if you want to learn more about it.
And a question from Jason. I think it's a really good one for you, Nathan.
Yeah, I see there's a question about Washington State and other states that might be restrictive anyways. Right now, we're not signing up new members for Washington State. So we're not doing that for if a member was to be in Washington State trying to join, that would not be available in Washington. There are other states, all the other states we're able to share in for the Zion HealthShare, including Pennsylvania. I see that's listed. There are states that don't allow commissions. So if you have an agent looking to get paid in commissions for, I believe that Pennsylvania is one of those states, then it wouldn't be able to do that for those states. But we are able to share as a community for members in all the other states anyways.
Okay, so in Touch Primary Care, another quick question. I think maybe the way I'd probably address that one in terms of if your rates are higher, probably my recommendation would actually be to contact the Hint Connect team through that form and have a conversation with them. For now, the sort of way it works, it probably doesn't work, but I think a conversation with them, we can figure something out and try to figure out what the right approach is there. Whether it be joining Hint Connect or maybe just recommending that patient joins Zion independent of the Hint Connect relationship. But there's some options there, and I think a conversation with Hint Connect team's the way to go.
Yeah, and to add to that, if I can, Zach, Zach, you mentioned we've had a good relationship working with Hint over the years, and there's a lot of DPCs that currently work with Hint and work with Zion HealthShare, and there's a lot of different ways of going about that, and that's been a pretty good process. This new way is not going to remove those other options. It just enhances the capabilities that you guys have.
Yeah. And at some point, we may evolve the program to enable a little bit more flexibility. However, we're with price points, but with this plan, we're trying to move very quickly and wanted to get something stood up. So there are some limitations. Over time, we're going to evaluate different ways of approaching them. But yeah, I would say I think a conversation with the Hint Connect team is probably not a bad place to start. So Camilla, so just to clarify, could we sign patients up through Hint Connect and Zion, or does it go through you all? And And is this just for companies or individuals? Yeah, so Camilla, this is right now for individuals. We would like to, at some point, open it up to employers, but then we're just sort of focusing on the individuals right now. And so the way it would work is technically, if the patient wants the Zion plus DPC bundle, they would be going through the link that we just walked through, where they enroll with Zion, and then they'll automatically get enrolled in your clinic on the DPC side as well. So that's how it works. Is they'll go through, you'll go through this process we just showed you. And again, if you want to give your patient a specific link for Zion, for the Zion bundle, that only lets them pick your clinic, right? You won't even give them an option to pick anything. It would just automatically sign them up into your clinic. We can generate that link for you, and that's the link you can give to that patient. So from their perspective, it'll actually kind of feel like they're just somewhat just enrolling with you, and also just getting the Zion bundle right there. Great. And Camilla, yes, we'll have this recorded, and you can preview it anytime you like as well in terms of the recording. There's a question from Mike. Maybe Nathan, do you want to take this one?
Yep. Yeah, the question about brokers, there's no license requirement for someone to sell the Hint Connect or the DPC membership with a Zion HealthShare membership. So there's referred to as a layperson. Yeah, anyone that there is some training that they'll need to go through to learn about how the program works, but there's not a insurance requirement for that.
Cool. Great. So I think it seems like and if there's any more questions, please get them through to us. But yeah, I think I just wanted to sort of reiterate, I'm very excited about this program. It's something that Nathan and I have been talking about for some time, and trying to figure out like more ways to collaborate. And so I think this is a really powerful program, and excited to push the collaboration forward and see if there's ways of getting more affordable healthcare to as many people as possible. So Nathan, any other kind of thoughts or anything?
Yeah, I'd love to add and echo my sentiments with Zach. Is this is a great opportunity. I know a lot of DPCs I've talked to in the past have asked for something like this to make it easy, to make it so that it's scalable, something that members can work with. They want to be able to figure out how we could send members to them. Part of what we need is, of course, participation in the Hint Connect community as a provider. So we definitely want to see that to continue to increase. And so I'll say that is that we really want the DPCs to participate and grow with us, and we're stronger together. So if there's any way that we can help you in this process, we want to do so. Feel free to reach out to the Hint Connect team, and of course our team as well.
And just maybe someone on our team, if you just put the link up to learn more about either joining or joining Hint Connect, or showing your patients where they can enroll, please do so. And again, if you're interested in getting kind of more materials or your own custom link that allows folks to sign up directly to your clinic with this plan, please reach out to either the Zion team or the Hint team, and we'll make sure that you're looked after. And yeah, again, Nathan, we've really enjoyed our long collaboration, and excited to continue sort of pushing this forward. So thank you everyone for signing in today, and we'll hope to see you all soon. Thanks so much.
Thanks everybody.